Hello, everyone. My name is Lorraine Williams, and Elaine Munzer and I want to thank you for viewing this Medicare 101 video presentation given by Bucks County PA Medi. PA Medi stands for Pennsylvania Medicare Education and Decision Insight. PA Medi is the name for Pennsylvania's State Health Insurance Assistance Program. SHIPs are available in every state. PA Medi offers free health benefits counseling to Medicare beneficiaries and their families or caregivers. Our mission is to educate, advocate, counsel, and empower people to make informed Medicare benefits decisions. PA Medi is an independent program funded by federal agencies and is not affiliated with the insurance industry. PA Medi staff and volunteer counselors are certified by the Pennsylvania Department of Aging and are highly trained and well qualified to help Medicare beneficiaries understand their health care coverage options. All information gathered is strictly confidential. What are PA Medi services? Well, counselors provide free, unbiased Medicare counseling services which are personalized to your individual medical insurance needs. The PA Medi program also focuses on community education and outreach, such as this presentation. The counselors provide screening for financially based eligibility programs including PA PACENet, Federal LIS Extra Help, and Medicare Savings Programs. The Bucks County PA Medi program currently has approximately 20 Medicare volunteers. Counseling sessions are provided throughout the year with additional sessions during the annual open enrollment period, October 15th through December 7th. In understanding Medicare, the following topics will be discussed. What are the parts of Medicare? What are the Medicare choices? How do you enroll in Medicare? And what does Medicare cost? Medicare has 4 parts, commonly known as Part A, which is hospital insurance, Part B, which is medical insurance, Part C, which is Medicare Advantage, Part D, prescription drugs. But please note, you must have Part A and Part B to choose a pathway for a supplement or Medicare Advantage. You must have Part A or Part B to enroll in Part D. So here are your Medicare choices. You choose one of these pathways, either Original Medicare or Part C Medicare Advantage plan. Original Medicare consists of Part A, hospital, Part B, medical, and you would receive a card. It would be a red, white, and blue card. And these are the only parts of Medicare, the Part A and Part B, provided by the government. To that, you add a prescription drug plan, also referred to as a PDP, Part D, and you have the option of adding a Medigap supplement policy or coverage from your retiree, Medicaid, TRICARE, Indian Health Service, or Veterans Administration. The other pathway would be your Part C Medicare Advantage plan, which consists of HMO, PPO, or SMPs. They include Medicare services, Part A, hospital, Part B, medical, and Part D, prescription. Advantage plans are provided by private insurance companies that are approved by Medicare. They have network providers that you must use or you may have to pay more. They may have vision, dental, hearing benefits. You will likely pay deductibles, co-payments, and or co-insurances for covered services. You must use the Part C drug coverage. Now we'll discuss Part A and Part B. How and when do you enroll in Medicare? You are eligible at the 65th birthday month or the 25th month of disability. Social Security automatically sends Medicare cards to those eligible if you are receiving Social Security or Railroad Retirement, Social Security Disability, which you are eligible on the 25th month of your disability, or the Supplemental Security Income, which is SSI. If you're not receiving the benefits I just spoke of, you can apply at the Social Security Administration by phone, mail, fax, or online at www.ssa.gov/benefits. You're eligible the 3 months before your 65th birthday, the 65th birthday month, or 3 months after you turn 65. If you enroll in the 3 months before your 25th month of disability, your Medicare starts the first day of the 25th month of your disability. Or if you enroll in the 3 months before your 65th birthday, your Medicare starts the first day of your 65th birthday month. If you enroll in the 25th month of disability or your 65th birthday month, your Medicare starts the first day of the following month. If you enroll in one of the 3 months following your 25th month of disability or your 65th birthday, your Medicare starts the first day of the following month. Let's talk about Medicare and your employer coverage. Are Part A and Part B needed? There are tax implications if you enroll in Medicare while contributing to a health savings account. It is recommended to stop HSA contributions 6 months prior to enrolling in any part of Medicare. If you are covered by active employer insurance, you may not need to enroll into Part B. When active employer coverage ends, you receive a special enrollment period for Part B without penalty. If your employer has less than 20 employees, you must enroll in Medicare Part A and Part B. If you are receiving Medicare because of disability, not age, and have group health plan coverage through your or your spouse's employment, and that employer has less than 100 employees, Medicare is your primary insurance and you need to enroll in Part A and Part B. COBRA is not considered creditable coverage for Medicare Part A or Part B. You need to be careful to avoid late enrollment penalties and gaps in coverage if you have COBRA. Also, always speak to your benefits administrator about your group's health plan coordination with Medicare. In regards to Medicare and Marketplace coverage, the Marketplace subsidies and tax advantages end when you become eligible for Medicare Part A, even if you do not enroll. So what does Medicare cost? Medicare costs may include monthly premiums, deductibles, coinsurance, co-pays. Here are the 2023 costs of Parts A and B. Part A premium is based on employment history. It's free and paid through payroll taxes if you or your spouse worked 40 quarters, which equals 10 years or more. Part B premium for 2023 is $164.90 per month per beneficiary. It must be paid in order to receive Original Medicare, a Medigap supplement, or a Medicare Advantage plan. It may be paid by the state if you meet financial eligibility criteria, such as the Medicare Savings Program. It may cost more if you have a higher income level. It's referred to as an IRMA, and that stands for Income-Related Monthly Adjustment Amount. Here are the Part A and B coverages. Part A coverage is known as hospital coverage. $1,600 deductible for each hospital benefit period for the year 2023. It includes short-term skilled nursing facility stays, limited skilled nursing home health care, and hospice care. Part B coverage is referenced as medical insurance. Medicare pays 80% of outpatient medical coverage. There is a $226 annual deductible, and this includes doctor visits, medically necessary tests, durable medical equipment, and preventative services. I'm going to discuss Medicare option Part C. Part C is Medicare Advantage plans, and they contain Parts A, B, and Part D, and are in one policy. The most common Medicare Advantage plans are HMOs, which stands for Health Maintenance Organizations, or PPOs, which stands for Preferred Provider Organizations, or SNPs, which stands for Special Needs Plans. They must cover the same benefits and services as original Medicare. They may provide extra benefits such as vision, dental, hearing, etc., and usually requires using a local HMO or larger PPO network of providers. It has its own rules to follow for receiving benefits. They may have deductibles, co-insurance, and co-pays for services, and they may need referrals or prior authorization for services. Here are some additional information points on Medicare Advantage plans. If you have both a Medicare Advantage plan and Medicaid, known as being a dual eligible beneficiary, Medicare is your primary coverage for health care and prescription drugs, and Medicaid is secondary. You may choose, or you will be assigned to a community health choices plan, which is an umbrella that manages your Medicaid benefits only, not your Medicare. Costs vary by individual plan. Most involve deductibles, co-pays, and or co-insurances. Monthly premiums can be as low as $0 per month. Most include Part D prescription plan coverage and extra such as dental. Monthly premiums can be as low as $0 per month. Most include Part D prescription drug coverage and extras such as dental, vision, and hearing. You cannot be enrolled in a Medigap supplement plan while in a Medicare Advantage plan. When do you enroll in a Medicare Advantage plan? During your initial enrollment period, which is the 3 months before your birthday month, and the 3 months after your birthday month. A special enrollment plan period. Annual open enrollment periods, October 15th through December 7th, and you must have Part A and Part B. Your Medicare Advantage open enrollment period is January 1st through March 31st, and that you must already be enrolled in a Medicare Advantage plan. Once yearly to a 5-star plan from December 8th to November 30th of the following year. And now Elaine will discuss the other Medicare options, Part D, Medigap supplements, and give an overall review.
Thank you, Lorraine. What do we mean when we talk about Part D Medicare prescription drug coverage? Part D provides coverage for outpatient prescription medications. It is offered through private insurance companies as a standalone prescription drug plan, a PDP, for those with original Medicare, or as part of your Part C Medicare Advantage plan, which would be known as an MAPD. The Inflation Reduction Act of 2022 provides new Part D approved vaccinations with no out-of-pocket cost sharing for beneficiaries as of January 1st of 2023 for those on Medicare, and October 1st, 2023 for those on Medicaid. This includes the shingles vaccine series at no out-of-pocket cost. For Part D, you need a standalone PDP, as Lorraine had mentioned, with original Medicare, unless you have other creditable coverage, which means coverage comparable to that of Medicare. Part D plans have plan-specific drug formularies, list of covered drugs, and help with the cost of these prescription drugs. Part D drug plans, the PDPs with original Medicare, have a separate monthly premium, copays, and deductibles. Most Medicare Advantage plans, the MAPDs, include Part D prescription drug coverage. If you are considering Part D coverage, always check with your employer or union to determine if your current coverage is creditable, either through an employer group health plan, union benefits, retiree benefits, or COBRA coverage. You can enroll in a Part D plan during your initial enrollment period, which, as Lorraine had mentioned, is based on your 25th month of disability or your 65th birthday month. You can enroll during a special enrollment period, such as occurs when losing active employer group health coverage on retirement. You can enroll during the annual open enrollment period from October 15th through December 7th of each year if you have either Part A, Part B, or both A and B. Please note that if you do not enroll in a Part D plan during your initial or a special enrollment period, you may incur a lifetime financial penalty. Some additional information for during the annual open enrollment period from October 15th through December 7th. During this time, you can make an appointment with a PA Medi-Counselor to review your prescription medication and your plan options for the upcoming year. Or you can independently review your current plan and options and enroll in a new plan for the upcoming year if you have created a Medicare.gov account. The Inflation Reduction Act of 2022 has now limited prescriptions for many popular insulins to a maximum of $35 per prescription per month with no deductible applying. This rule is effective January 1st of 2023 for Part D insulins and July 1st, 2023 for Part B insulins, which are used with a durable insulin pump. The Inflation Reduction Act proposed changes that are upcoming are for 2024 a limit of 6% annual premium increases from the years 2024 through 2029, no cost sharing in the Part D catastrophic phase, and expanded LIS extra help coverage. For 2025, there is a proposed $2,000 annual cap on your out-of-pocket Part D costs. There is help for you with your prescription drug costs through the Federal Extra Help Program, also known as the Low Income Subsidy, LIS, through Pennsylvania's PACE and PACEMed program, or through various manufacturer patient assistance programs. The Federal Extra Help Program, which is again known as the Low Income Subsidy, the LIS, helps to dramatically lower your Medicare prescription drug costs. You may be eligible for federal extra help if you meet the income and asset limits, or if you receive Medicare Savings Program Part B premium assistance. Extra help benefits include the ability to change your Part D coverage once every quarter for the first 3 quarters each year, and again once during the annual open enrollment period. Any Part D late enrollment penalties that you have will be forgiven. There also is no coverage gap, known as the donut hole. You will have no or reduced premiums and deductibles and reduced copays. Pennsylvania also has a program known as PACE and PACENet, and to be eligible for this, you need to be 65 years of age or older, a resident of Pennsylvania for at least 90 days, not receiving full Medicaid benefits, and meet the PACE and PACENet income guidelines, which are much higher than the federal guidelines. And please be aware, this program financially is based only on your income. There are no asset or resource limits. Some additional information for PACE and PACENet is that it also eliminates donut hole costs. It will work with your Part D, PDP, your Medicare Advantage, employer, retiree, and other prescription drug plans to ensure you the lowest out-of-pocket cost. It will pay any Part D late enrollment penalty. You will have a special enrollment period once per calendar year to change your freestanding Part D, PDP, or your Medicare Advantage plan with prescription drug coverage. For questions or for enrollment help, please contact PACE and PACENet at 1-800-225-7223. Now an option that people on traditional original Medicare have. These are the Medicare supplement plans, also known as Medigaps. These plans may help cover your Part A coinsurance costs and percentages owed of your Part B coinsurance or copayment. It may help with your Part A deductible with the percentage based on your plan letter, and for people in Plan C and F, it will pay the Part B annual deductible. Monthly premiums for Medigap policies vary by company. The plan types are standardized alphabetically by federal regulations, and once you have a plan, you can only be dropped for failure to pay your premium or for submitting a fraudulent application. To enroll in a Medigap, you will contact the issuing insurance company directly or use a Medicare broker. PA Medi program counselors can assist you in explaining the coverage according to alphabet plan letter by providing insurance company names and contact phone numbers, and for providing cost estimates for your premium through our actuarial data system. So which pathway are you going to take? As Lorraine had explained, you have two choices: Original Medicare or a Medicare Advantage. Within these pathways, what choices do you have to make, and do you have any options to consider? Please contact the PA Medi program for personalized counseling, for providing you with the education and your available options so that you can make an informed decision. We can be reached at 267-880-5700. Please choose option 5. So a Medicare pathway review. Again, you have two pathways to choose from: Original Medicare or a Medicare Advantage plan. The Original Medicare will give you your red, white, and blue card with your Part A hospital and Part B medical coverage, to which you need to add a freestanding Part D PDP, a prescription drug plan, and to which you may optionally add a Medigap policy. Plan A through N are offered in Pennsylvania, or you may have secondary coverage through retiree, Medicaid, TRICARE, Indian Health Services, or the Veterans Administration. For those not staying with Original Medicare, there is the Medicare Advantage Plan choice, which is also known as Part C. These are the HMOs, PPOs, and SNPs. Your services will include your Part A, Part B, and Part D services provided by a private insurance company that is approved by Medicare. With a Medicare Advantage plan, you must use the plan network, doctors, and hospitals, or you will pay more. Some plans charge a monthly premium in addition to your Part B premium. You will also likely pay deductibles, co-payments, and/or co-insurances for many covered services. And if you have a Medicare Advantage plan, you must use their Part C drug coverage. So if you have Original Medicare, you can add an optional Medigap supplement plan, which you can use with any provider in the country that accepts Medicare. There may be no co-pays, co-insurances, or deductible, depending on the plan letter. With Original Medicare and a Medicare supplement, a Medigap, no referrals are needed for services. The coverage is standardized by plan letter A through N in Pennsylvania. If you want to switch your plan, you may have to undergo medical underwriting, medical history, and you can then be rejected for pre-existing medical conditions. You can only be dropped for failure to pay your premium or for submitting a fraudulent application once you have enrolled in a Medigap supplement. To be guaranteed obtaining the Medigap supplement plan of your choice without having to undergo medical underwriting, you need to do this during your initial enrollment period or a special enrollment period. So back to our pathways. If you do not have Original Medicare, you can have a Medicare Advantage plan. These are the managed care HMOs, PPOs, and SNPs. The plans may have only a localized network of providers, as with most HMOs, or you may have a larger regional, national, or out-of-network benefit with PPOs. Most Medicare Advantage plans will include Part D coverage. The monthly premium may be much less than if you have Original Medicare, to which you have added a freestanding Part D PDP and also Medigap supplement premiums. With the Medicare Advantage Managed Care Plan, you will have co-pays, deductibles, and/or co-insurance for many services, and the benefits and provider networks vary from plan to plan. If you have a Medicare Advantage plan, you can change your plan during the annual open enrollment period in the fall or during the Medicare Advantage open enrollment period from January 1st through March 31st. With a Medicare Advantage plan, you may get some extra benefits such as hearing, dental, and vision, sometimes at an extra cost. You need to be aware that not all doctors, hospitals, or providers accept all Medicare Advantage plans. And for 2023, there is a maximum out-of-pocket cost up to $8,300 for Part A and B services. For resource information, you can contact us at Bucks County PA Medi for information, presentations, or individual counseling appointments at 267-880-5700, option number 5. You can contact Medicare at 1-800-633-4227 or online at www.medicare.gov. The Social Security Administration, which is who handles Part A and Part B enrollment, is at 1-800-772-1213 or online at www.ssa.gov. If you are not a resident of Bucks County, you can find your local PA Medi program in the state by contacting 1-800-783-7067. Again, to ask a question, schedule an appointment, request a presentation, or for information about joining our exciting volunteer team, please call the PA Bucks County Medi program today at 267-880-5700, option number 5. The PA Medi program is brought to you by the Bucks County Area Agency on Aging. And Lorraine Williams and I would like to thank you for listening to our PA Medi 101 Medicare presentation. Thank you very much.